Hi, I'm Dr. Bernardo Mendes. I am the co-director of the UCLA Health Aortic Center. I am a vascular surgeon specialized in aortic surgery. Over the last 20 years, aortic surgery has changed in remarkable ways. In the past, aortic aneurysm repair was always a major open operation. We had to make long cuts in the chest or abdomen, and these procedures carried significant risks: stroke, kidney failure, and death. Even when the procedure went well, recovery could be long and difficult. Patients often stayed in the hospital for a week or more. This procedure carried a death rate of 2% or even higher for complex cases. Today, options are better and in many ways safer. With modern techniques, we can repair most aneurysms through a tiny puncture in the groin. Instead of opening the chest or abdomen, we guide a small tube through the blood vessels to place a stent graft. A stent graft is a metal frame covered with fabric that we can insert inside the aorta. Once in place, the stent graft opens up and forms a new channel for blood to flow through. This takes pressure off the weakened part of the aorta, which greatly reduces the risk of rupture. These stent grafts are also highly durable and can hopefully last for decades. The difference in patient outcomes has been dramatic. The chance of complications is significantly lower than with open surgery. Patients recover faster, spend less time in the hospital, and return to normal life sooner. Our goal in treating an aortic aneurysm is simple: to prevent rupture. Ruptured aneurysm is a life-threatening emergency. Most people who experience one do not make it to the hospital in time. By finding and fixing aneurysms early, we can save lives. All patients will need follow-up to ensure the repair is looking good. Some patients may need more procedures over time. These are usually simple and thankfully minimally invasive. Endovascular repair has completely changed how we treat aortic aneurysms. It is safer, faster, and less invasive than ever before. We are very proud to bring advances, safety, and compassionate care to our patients to help them live longer, healthier lives. Again, I am Dr. Bernardo Mendes with the UCLA Health Aortic Center. Thank you for listening.